Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of my health talk today is very interesting. It is the diagnosis of autism among children 12 months to 5 years of age. As we all know, autistic children, what are the causes? I'm going to talk to you some of the causes, what causes the autistic spectrum in the children, and it persists to the adulthood also. Before, there used to be more emphasis given about the attention deficit disorder, but we did not know that those attention deficit disorder, they also might have the autism. So what is the cause? What does the autism mean? It is a development disability caused by changes in the brain function, and that leads to a delayed social communication interaction in the children. So these children, it is, like I said, developmental disability. These children often have a problem with the social communication, interaction. They have a restricted behavior, interest, and they can also have difficulty with the focusing, paying attention to their caretakers, parents, school, and the college. Now, our goal is to diagnose this as early as possible. So a lot of researches have been done, and the experiment how early the diagnosis of a baby with autism can be made. So now I just talking about what are the risk factors. The current available research proves that the fact that basically in the children's brain, there are certain chromosomes or genetic conditions, and later on I will show you a picture of the chromosomes that predisposes to development of autism in children. And the main cause is the genetics. There is evidence to suggest the genetics play a very significant role, and statistics show that it's more common in the male than the female, and presumably the genes are passed through the father. So there has been a lot of researches done about this, and one of the experiment done about this, a link between the chemical marks on the sperms of the father of a 3-year-old child. I put the biblio there, and so inheritance pattern is unknown. However, a child can also develop autism even if it doesn't, even if it is not genetic, even if it is not hereditary. So what are some of the causes? There is environmental factor, biologic, genetics. The other risk factor includes that a sibling with autism, mother is old, certain genetic conditions such as Down syndrome or Tourette syndrome, and they have been described in the Institute of Environment Health Sciences. Furthermore, for the mother to know. Furthermore, there are complicated pregnancy, elderly age, premature birth, low birth weight, and also maternal history of diabetes, high blood pressure during pregnancy. There's a high level of stress. All this further leads to autism in a born child. The behavioral symptoms of autism spectrum disorder, very interesting to know that it can be detected as early as 12 months of age. And NIH has done a lot of experiment and studies on this particular issue. Following are the signs of autism. In the babies, they have a limited eye contact, repetitive movement of the whole body, no response to hearing their name, and limited or no response to the loud sound. They have a delayed or infrequent babbling. These babies usually, when you look at them, they are cute and they are well developed. The older kids, as they grow older, they have a delayed cognitive learning skill, hyperactive, impulsive in attempting. So basically, our whole aim is to diagnose them as early as possible so they can be under proper care for that. So the older kids, like I said, have delayed problems. So what are the diagnostic tools for that? So the diagnostic tools for the autism, two of the leading diagnostic tools to screen and diagnose are DSM-5 and MCHAT. This is a modified checklist for autism in children. So what is the role of pediatrician? The role of pediatrician is to, when they see the child, when they see the baby at their office, do a complete examination, follow the baby's signs, routine checkup of their development, physical and mental development. According to the Academy of Pediatrics, they have a growth chart, and also they have a growth chart with the National Institute of Autism, how they're diagnosed. And then later on, if the diagnosis is at least suspected, the role of pediatrician is to send the baby for a social service, for a psychological evaluation, and the applied behavior analysis. It has consistent with the law of learning, which is derived from the behavior. Autistic children may have a different behavior issue, best described in the developmental delay. The social worker, the school health nurse, they play a significant role once these children grow a little older and go to the kindergarten. So the types of treatment, what is the treatment part there? Before I go, these are the several signs of the autism: avoid eye contact, they line up the object, they will cry. Those babies, they are unable to focus their eyes, and babbling of the head is very common. There is a pediatrics developmental screening flow chart, and this is how at the pediatrics office they are given this, and once they are given this sheet, the parents, caretakers, they are going to follow the procedure, follow the guidelines before they go to the final. It will describe the condition, autism spectrum disorder, which could be mild, moderate, or severe. So there are 3 levels of autism spectrum, and this one is diagnosed in the Static Mental Disorder Manual. The level of so what is it? The early symptoms correlate when the kids grow a little bit older, like 3 years above, going to the pre-kindergarten to nursery school here, the early symptoms of autistic child correlate clinically with attention deficit disorder, because this is like I mentioned before, this is a developmental disability caused by changes in the brain function. The children have problem with social communication, interaction, or avoid eye contact. So where is the issue? A lot of studies, researches have been done in the brain of these kids. Now, this is a picture of the brain, and also in the front of my write-up is there. This is a picture of the brain that shows frontal cortex, parietal, occipital. And the frontal cortex of the brain is covered by lots of groups. They are the groups and the convolutions and the group. And basically what happens, the neurons, the dendrites, they are more clustered in the brain cortex of an autistic child brain. So basically what happens, these children, the abnormal genes, chromosomes that they are getting from their parents, those abnormal chromosomes, they kind of clusters in the dendrites of the nerve function. And here is that's a little broadly, I don't have a complete diagram, but this is how the nerve endings go. And this is where the clusters is of the dendrite. Now, these dendrites have abnormal chromosomes and abnormal neural behavior. And this is what is responsible for causing the autism. So now, what are the treatment? Most important thing is early diagnosis. The earlier the diagnosis is made, better it is. So baby's brain begins and completes by its age of 3 years of age. So the most important thing is the early diagnosis. What are the types of treatment? Include behavioral development, education, and behavior child should be consistent with the law of learning that is derived from behavior from other. Autistic children may have separate behavior issue best described in the developmental delay. The social worker has a big role on it because they correlate with the family, with the school system, and they report to the psychologist, social relation. Psychological evaluation is done if a child has a mild, moderate, severe autistic disorder, because the psychological treatment is something different, and the aim of the current treatment is to reduce the symptoms of autism that interfere with the daily function and quality of life. So in short word, in summary, the management of these children with the autism spectrum is a multi-specialty field. It involves first of all the parents, caretakers, social worker, at the school health nurse, and then they can be sent to the psychologist evaluation. All these things I have collected the script and I wrote it from my own experience, because during my clinical practice, I did encounter several autistic children, and some of them did very well in life, while the other ones they did not do very well in life. So just to make the story short, the symptoms, they have noticed that the female, it's more in the male than the female. And the earliest the symptoms are evident, the harder it becomes later for them, to manage the lifestyle and all that. So I wrote this script from my own experiences working with the pediatrics. I don't have any research grant. The only thing I advise our readers, our readers of my script or watching my health talk, to get the advice and follow up from their pediatrician and the expertise is involved. Lastly, I'd like to thank you for listening to my script about the autistic children and early diagnosis. I'd like to thank our producer for helping me make this video. I'd like to thank our viewers for listening to me. And in future, I'm going to come up with more research that has been granted for this. And there has been a recent one that is a visual diagnosis of the babies with the autism. And this one is very interesting because the babies, they sit by the computer screen, they watch their show, and somebody is watching their visual expression. So this will be a very interesting topic later on, visual diagnosis of the babies with the autistic child. And I thank you again for this opportunity given. Thank you.